Asthma is an inflammatory disease of the airway tubes, and the best treatment available is using the inhaled drugs. In inhaled therapy, the very important factor is that the drug reaches these tubes at the right site. And to help this, there are various devices which are available in terms of pumps, in terms of rotahalers, revulizers, and many others. It is very important that you do these inhalation therapies with a proper technique, because if you do it in a proper technique, only 20% of the drug actually goes into the airways, and that is what is required. If there is any mistake in how you do it, these drugs don't reach at the proper site, and then the patients usually do not have a proper response. So it is very utmost important that the patients are taught and again checked how we are doing these inhalation practices. Today I am going to demonstrate how to use an MDI with a spacer. An MDI is a pump, it's a pressurized metered dose inhaler, and this is a spacer. A spacer is usually a tube which holds the drugs for a while. Now, how is this MDI attached to the spacer? There is a cap to the spacer, and there is also a cap to the MDI. Now, both these cap ends don't meet. It is usually on the opposite end of the cap. Now, when you're using the inhaler for the first time, it is important that you prime it and then release 3 pumps. This is to be done only when you're opening the pump for the first time. Every time when you're using it again, you just have to prime it. You attach it. Now, when this entire assemble is ready, it needs to be if you need to hold it in your mouth, you need to hold it with your teeth and then seal it with your lips. Before doing this test, it is mandatory that you empty your lungs completely, so that you can take a proper inhalation. After exhaling and holding, you need to press it once and then take a deep inhalation, a very slow inhalation. It should not be a fast inhalation. It should be a deep and a slow inhalation, and you should hold the breath for at least 10 seconds. Once the 10 seconds are over, you should slowly exhale from your nose. Then once again you need to take a deep inhalation from the same spacer without pressing. Hold it for 10 seconds and then leave it again, and then you can remove the tube. I will demonstrate once how we do it. So I'm using it, I'm first priming it, attaching it to the non-cap end, hold it in my teeth and lips, but before that I would deeply exhale. I keep my chin a little up. That's it, how it is done.